All right, welcome. In this Clinical Skills Explainer, we are going to get our hands dirty with one of the most powerful and, let's be honest, often most challenging tools in our entire CBT toolkit, homework. Getting this right isn't just about learning a new technique. It is a core competency that can completely transform your clinical outcomes. So let's dive in. First things first, let's just ground ourselves in this foundational principle. In CBT, homework is integral, it is not optional. Think of it as the very engine of therapeutic change. Honestly, if you treat it as just an afterthought, you're kind of missing the point of the whole model. So here's our game plan. We're going to start with the why. Why it's the engine of therapy. Then we'll get into the how, designing great assignments and, crucially, mastering adherence. We'll also troubleshoot what to do when things go off the rails, and we'll wrap up with a key takeaway that I think will really shift your entire approach. Okay, so let's really establish why homework is absolutely non-negotiable for us as CBT clinicians. Just think about it for a second. Our session, it's 1 hour. 1 hour out of 168 in a week. The real work, the stuff that actually sticks, it happens out there in the real world. Homework is the bridge that connects the safety of the therapy room to the patient's actual life. It's what makes the therapy real. And look, this isn't just a clinical preference or a nice idea. The science on this is crystal clear. The research consistently shows that patients who actually do their assignments get better outcomes, period. Homework adherence is one of the single best predictors of success in therapy. Okay, so if we all agree that homework is essential, the big question becomes a clinical one. How do we design assignments that actually work, that really move the needle for our patients? And what you see here is just a glimpse of the huge toolkit we have at our disposal. It is so much more than just handing out a thought record, right? We've got behavioral tasks, cognitive exercises, experiments, reading, you name it. Your real skill as a clinician is knowing which tool to pick for which patient at exactly the right time. And this is the key. There is absolutely no one-size-fits-all formula here. A brilliant assignment is always tailored. You have to be thinking about your patient's motivation, how distressed they are, and just the practical realities of their life. What might empower one person could totally overwhelm another. Okay, now we get to the real heart of this masterclass. Because, designing a clever assignment is one thing, but making sure your patient actually does it, that is a whole other skill set. And frankly, this is where a lot of well-meaning clinicians fall down. If you follow these 4 steps, I promise you, your success rate will go way up. First, tailor it. And hey, when in doubt, make it easier. A small success is way better than a big failure. Second, always give the rationale. People need to know why they're doing something. Third, set it collaboratively. This has to be a team effort. And fourth, and this is huge, anticipate problems and rehearse what to do before they even leave your office. This question right here is your clinical magic wand. It's probably the most important question you can ask after setting an assignment. And listen closely to the answer. If you hear anything less than, say, 90 or 100%, ding, 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 that's your signal. That doesn't mean you scrap the plan. It just means your work isn't done yet. You've got to figure out what that hesitation is all about right now. And one of the best ways to explore that hesitation is with a technique called covert rehearsal. I want you to think of it like a flight simulator for the mind. You're not just talking about the assignment, you're using guided imagery to have the patient mentally walk through every single step. And trust me, that's where the real roadblocks, the pesky automatic thoughts and feelings are going to pop up. So let's see what this actually looks like. Imagine our patient, Sally, has agreed to go ask her TA for help. But when you ask her, hey, from 0 to 100%, she kind of hesitates. That's our cue. Perfect time for some covert rehearsal. So you start by grounding them right there in the scene. You want them to feel what they're gonna feel. Think what they're gonna think. Can you picture it? Where are you? What do you see? The details matter because they make it real. And boom, there it is. She just uncovered the exact thought, maybe I'll just read the chapter again, and the feeling, nervous, that would have completely derailed the whole thing. Without this little rehearsal, that thought would have ambushed her on Friday morning, and I guarantee you the homework would not have happened. So now that the real obstacle is out in the open, you can tackle it together, right there in the session. You can help her come up with an adaptive response, a counterthought. See what just happened? You didn't just rehearse the task, you rehearsed overcoming the mental barrier to the task. Game changer. Now, of course, even when we do everything right, sometimes assignments just don't get done. And your job here isn't to get frustrated or annoyed. Your job is to be a detective. Non-adherence isn't a failure. It's data. It's telling you something important. And usually the reasons fall into one of these two buckets. On one side, you've got practical problems. Maybe they just forgot, or they were disorganized, or, let's face it, maybe the assignment was just too darn hard. That's on us. But on the other side, you have the deeper psychological stuff. Negative predictions, perfectionism, those underlying core beliefs. Now here's a real pro tip. A key clinical skill is sniffing out when a practical problem is actually a cover for a psychological one. I didn't have time is the all-time classic. So before you jump in and start trying to rearrange their schedule, just pause. Ask something like, okay, I hear you, but let's imagine you did have the time. What else might have gotten in the way? You'd be amazed what comes out. And finally, we got to look in the mirror, because sometimes the barrier isn't the patient at all, it's us. Our own thoughts as therapists can get in the way. So if you find yourself kind of avoiding sitting homework or you let non-adherence slide, check in with yourself. What are you thinking? Are you worried they'll think you're too pushy? Do you secretly believe they're too fragile for this? Our cognitions drive our behavior too. So let's pull all these threads together. What is the single most important idea I want you to walk away with from this masterclass? It's this. This is the whole point. When a patient goes out and does something they thought was impossible, they're not just checking a box for you. They are gathering cold, hard evidence that they are capable, that they can actually change their own lives. This is how we build self-efficacy, and self-efficacy is the bedrock of lasting recovery. And that brings us to this simple but incredibly powerful reframe. Your job is to stop calling it homework. From day one, talk about it as their action plan. That one-word change shifts the entire dynamic. It's not a chore they do for you, it's an empowering plan they are creating for themselves. So as we wrap up, I want you to really think about that question. In your very next session this week, how are you going to use this? How will you shift the language from homework to action plan? Because when you master this, you're not just being a better CBT therapist, you are literally empowering your patients to become their own therapists. And that, my friends, is the work that truly lasts.